The new strategic plan is a really exciting opportunity for Austin Health. It really sets out our vision for what we want to achieve and what our priorities are over the next 5 years.
Austin Health will be confirmed as a leader in its field, both the provision of community services but also tertiary and quaternary services in Australia, and we already lead the world in some of our research, so there's a combination of outcomes that will be stronger.
One of the biggest things that we cater to is timely access for patients to see the specialists that they need. We see over 300,000 patients a year that are getting referred through the community via GPs. Looking at that kind of volume, we've actually introduced a full digital journey. It goes straight to our electronic system. There's no more paper, there's no more printing, and everyone knows exactly where the patient is at any one time.
Austin's one of the few places where we combine clinical practice and research in an amazing way to improve the way we treat patients.
What we have an opportunity for is to really enhance the rigour in our practice and our evidence-based care. We know that the health workforce wellbeing really influences both patient outcomes and the outcomes of our community. So we're building a capability amongst our nursing workforce, building relationships with universities, with other health organisations and other academic partners throughout Melbourne and more globally.
At the Austin, we've been a leader in infectious diseases, COVID and other antimicrobial research. The way we build upon that experience of the last 2 years is the way we're going to treat infections in the next 10.
The Austin's a great place to work because we're very supportive of education. Simulation is increasingly embedded in all of our education practices. We can observe how people perform in a scenario. We work in teams, so we actually train in teams as well. New staff coming to the Austin are well supported.
Austin Health are continuing to improve the space that our patients are cared in, making sure that our spaces are safe, functional, and it's a good place for the patients to be ultimately.
Quite a lot of people have different needs, so the Austin supports people with disability as inpatients and supporting them out in the community. Through the Disability Liaison program, we can do things like booking accessible parking for them, take people through screening, almost be their voice talking to people in the healthcare system. We will get a lot of consumer feedback, find where the gaps are in the healthcare and try to fill those gaps.
So Narrajara Aboriginal Health Unit started in 2005 and supports Aboriginal and Torres Strait Islander patients and staff with their healthcare. By having Aboriginal health liaison officers, you have mob that's helping mob within the community and providing support in a culturally safe way. We've just recently released 2 policies, so a smoking ceremony policy and a sorry business and sad news policy. So we are the first in Victoria to actually release these policies. So they provide cultural needs and practices into Aboriginal healthcare, and being able to do smoking ceremonies for patients, we love Austin for that. So it just brings a place of knowing and home for staff and families and having a safe space here at the hospital.
The collaboration within the team to deliver innovative technology solutions is just wonderful. There's no other way to describe it. Our strategy is continuing to improve our clinical system of record, streamline communication with our patients, and also delivering AI and machine learning type projects. It'll really provide a holistic view of our patients with them at the centre of the care.
I love the passion at Austin across the board. It's an organisation that has a huge amount of energy. It's great to be part of that.
There is fantastic opportunities here at Austin to make a real difference in the health professionals' lives, in our patients' lives, and in the lives of those in our communities.
There is a big impact in what we do, and we don't take that responsibility lightly, and so we're really excited to see what happens next.